Let's talk about ulnar-sided wrist pain. What the hell is that even? That's ulnar-sided wrist pain. So if you have wrist pain on this side, one, the hell is it? Why do you have it? And two, how the hell do you get rid of it? Well, that's what we're going to talk about. That's what I'm going to share with you today. My name is Huang. I'm an occupational therapist and certified hand therapist. And in my clinic, I see a lot of people with ulnar-sided wrist pain. So it's a little bit more complicated than just do this exercise and it's going to cure all. First of all, you got to know why you have it in the first place. So I'm going to bucket them into two separate problems. One is going to be a chronic problem, and one is going to be what we call an acute or after surgery problem. That's my shorthand writing for you. That's what I write when I teach, right? So we're just going to bucket them into two separate categories. One is chronic. You didn't fall, you didn't do anything, you didn't hurt yourself. You're like, why do I all of a sudden have this type of problem? And then the other type of problem is when you have ulnar-sided wrist pain because you've had surgery, you had a fall, you had an injury, that type of thing. And we're going to talk about that in a whole separate video. But what is ulnar-sided wrist pain? Ulnar-sided wrist pain tends to be pain right here on the side. We call this the ulnar side of our wrist, right? We call this the ulnar side, and then we call this side the radial side. So if you have radial-sided wrist pain, you might have Decker-Vaden's tendonitis, some other, other stuff, and those are in some other videos that I did, but we're going to talk about this side of the wrist now, and this is ulnar-sided wrist pain. So ulnar-sided wrist pain, usually it's not just because you're moving it up and down that causes pain. Ulnar-sided wrist pain tend to be painful when you turn your palm up and turn your palm down. And here's why you have that. We have two major muscles on that side of the wrist. They're called an extensor carpi ulnaris. It's the ulnar ulnaris, and then the flexor carpi ulnaris. So you have one that comes right around here, starts in your elbow, slides all the way down, and it comes up and it stops right here. That tendon here, that's your extensor carpi ulnaris. And what's interesting about this tendon is that every single time you turn your palm up and turn your palm down, that tendon likes to roll. So that tendon moves. So if you're hearing a lot of clicking and popping, it might be that tendon saying, hey, we have a problem here, right? And then the other one is down here, and it also starts on the inside of your elbow. The other one starts on the outside of your elbow, and it comes across and it comes right here. And these two muscles flank the side of your wrist, side of your ulnar wrist, and it can hurt. There's other structures there, but a lot of times if you have ulnar-sided wrist pain, one of the first places that I'm going to look at is I'm going to look at your muscles, right? And see if you have a tendonitis. The other very important part of any kind of ulnar-sided wrist pain is actually your TFCC. It is a complex of ligaments. Now, ligaments hold bone and bone together and give you stability there. And that sucker is right, you see this crease? I drew it all over it already. You see this crease right here? So that crease right inside, when you turn your wrist to the side, that's your TFCC. So usually when patients come to me, I just double check, hey, is that good? And if it is good, and if you didn't have a fall, so the ligaments get hurt when you have a fall and you put your arm out. When your wrist, for whatever reason, gets twisted, ligaments are very strong, so it takes a lot of impact to hurt them. So twisting, something heavy falling on top can injure those ligaments. But if you didn't have any of those things, you might just have a chronic type of problem. Now, I had a patient come to me a few years back. Both her wrists were jacked up. She had been having those problems for like 3 years. We fixed them. And then recently she just came back with ulnar-sided wrist pain. She's like, I don't know why I'm starting to have problems every single time I turn my palm up. It was hurting one arm more, but it was starting to affect the other arm. Because she's a patient of mine, because she's a past patient of mine, she one, I know her. Two, she knows that if she comes in early, it's easy to fix because she's already learned her lesson, waiting 3 to 4 years, wearing brace after brace after brace, trying tons of different things, and it didn't work. But you can try injections, all that good stuff. We'll get there. We'll get there in another video. Let me not get ahead of myself. So that's ulnar-sided wrist pain. If you're like, what is ulnar-sided wrist pain? This is ulnar-sided wrist pain. Majority of the time, it has to do with a muscle tendon imbalance, and that's what's causing you to have pain. Most of the time, it's not going up and down. Most of the time, it's turning your palm up. Now, when you turn your palm up, you also can move your wrist up and down, and sometimes that can irritate. So if you are, if you're experiencing that, let's talk about like, how do you get rid of it, right? How do you get rid of it? If you didn't have surgery, it's a muscle tendon imbalance there. So one of the things that I really look at is I look at how you're turning your palm up and turning your palm down. So what happens to people, and this is where it's, it's a little bit hard to just be like, hey, do this one thing, it's going to help you. I'm a big believer in, having outside eyeballs look at you, right? Because this is one of my favorite sayings. If you're inside the jar, you cannot read the outside label. So when you go into a therapy clinic, they can watch and look at how you're moving. And we're not looking at how much motion you have. Most people with a chronic problem, they tend to have a lot of motion, not have lost motion, right? But they tend to have motions in certain places. So when I'm looking at someone who's going to turn their palm up and down, look at my elbow, right? Don't look at she's turning her palm up and down. Look at your elbow. So what happens here is someone who cannot turn their palm up will wing their elbow in, and when they turn their palm down, will wing their elbow out. It's an elbow shoulder type of issue. So if you're going somewhere and you're like, I can't get rid of my ulnar-sided wrist pain, don't just stay right here. This is where you feel the pain, but that's not where your problem is. Your problem is probably a little bit more up here and up here. So this bone, this is your ulna. You have 2 bones in your forearm that allow you to do supination. This is what we call supination, right? So this bone right here, this is your radius. This bone turns on this bone. This is your ulna. So you have 2 bones. So this bone has to roll over the other bone. This is your ulna because that's the point of your elbow. It does not move. That bone does not move. It can go a little bit, but really it's this bone that rolls over. And so how do you roll over? Turning your palm up and down, it's like opening a door. You have a hinge, right? And a door, if only one hinge works and the other hinge doesn't work, the door doesn't open very well, right? You have a hinge right here and you have a hinge right here that allows you to turn your palm up and down. So sorry for the complicated anatomy lesson, but I just really wanted you to understand a little bit more about ulnar-sided wrist pain so that you can understand the concepts of like, hey, because my wrist hurts, let me just stay and massage my wrist. You're not going to get the results that you're hoping for. When I work with my patients and they come in and they have ulnar-sided wrist pain, I'm always coming up to their elbow and then I always go up to their shoulder. So one really great thing that I like to do that's really easy that I can show you to help with that, again, not everyone needs to be stretched. If stretching works for you, you wouldn't be landing on this video, right? Because there's a shit ton of videos out there and stretch it like this and, turn the arm like that. Like, been there, done that. If you want me to make stretching videos, leave me a comment. I will make stretching videos. But majority of the time, people are coming to my clinic and my staff here at Hands-On Therapy Services. It's usually because they've already tried the stretching and it doesn't work. So one of the best moves that I could show you is actually like putting it together, right? So there's 2 things. One is to squeeze it like this. If you squeeze it like this and it gets better, then that's one way to know that you're probably hypermobile, and you can squeeze here too and be like, oh, did that help, right? Did that help? Just kind of like putting the bones together and saying, did that help you? You know, you can't go around just holding your shit together. So then a lot of it can have to do with some strengthening. And one of the things that I find that works for ulnar-sided wrist pain, well, it just depends on where the problem is. I'm a big believer in there's an order in which to do exercises. For the sake of this video, one really great exercise that I like doing is actually tricep extension. Tricep extension can really help, because the triceps starts in the shoulder and then comes down to the elbow. And so when you work on your triceps, usually it's a big muscle, but a lot of times it's weaker than you might think. And when you have wrist pain, it's hard to push down and put weight, right? So it's hard to, push down and put weight because you keep constantly feeling wrist pain. So then what happens is your tricep works less. So a really great exercise to help can be tricep extension. There's a bunch more. Depends on why you have that in the first place. And since I don't know you, I don't know why you got it. But try those things out. Let me know. Let me know if that helps. But if you have a chronic issue, then what we really need to work on is overall strength, balancing out the big muscles versus the weaker muscles, the stronger muscles versus the weaker muscles, right? So let me know if that helps. Again, if you are in Miami, you can seek out our help. If you live somewhere else, there's ways in which we can do a consultation, but that is totally up to you. Find someone in your local area first, I always say. And if you still need my help, my link's all below. If this video has helped you, you like more videos like this, hit the like button, subscribe, leave me a comment, because when you do those things, it allows other people to find our videos. And I'm just sharing some of what I know, and hopefully it will help you. Again, my name is Huang, and thanks for watching my video.